My mom had fibroids, my sister had fibroids, so it was a given that I would have fibroids too. It's a hereditary thing. One fibroid was the size of a lemon, and I had another fibroid that was the size of a small grapefruit. And those were the two larger ones. Since I am small framed, I could not wear bikinis. I could not wear anything that was tight fitting around my waist because the fibroids would be visible. I would have a visible pooch. When I looked in the mirror, I felt like I should look young and vibrant, but then I would feel ashamed because I had this small pooch on my belly all the time. That would not go away with exercise. It would not go away with dieting. It was just there. The doctors told me that my options were a myomectomy, a hysterectomy, or to try experimental drugs, which could lead to the side effects of the experimental drugs were facial hair, weight gain. I was shocked that a doctor would actually recommend these things that could lead to infertility and would also, the fibroids could grow back. I mean, it wasn't a definitive answer to my problem. So I chose to just go ahead and live with what I was dealing with until I heard on the radio about the uterine fibroid embolization, and I made the decision right then and there to go ahead and get more information from the seminar. And after talking to Dr. McLucas, I was more than certain that this was a procedure that I wanted to have. I had grown up knowing that fibroids were prominent in my community, but finding some and listening to other stories from these other women that had actually dealt with what I was going through with all the heavy bleeding, and then hearing their stories, it encouraged me to even more so go through with the fibroid embolization. I was able to ask all of the questions that I had before going in and having this procedure done, and they were encouraging and telling me that this was the right thing to do, and they answered all of my questions with grace and honesty, and this procedure changed my life. The final thing that made me certain that this was the way to go was the fact that it was a simple outpatient procedure. It was not surgery. I did not have to be cut. There was not going to be any scarring. In the Black community, we tend to have keloid scars, and that was not going to be something that I would have to deal with, and my fertility was still going to be preserved. I wish all the people in my community would know about the fibroid embolization, because it is something that is so simple that could change your life so drastically. I feel empowered now that I've gone through the procedure, and I want to encourage other women to know that it's not something it's not a surgical procedure. It's not something that, you're going to be down for months at a time. Hysterectomy is a huge surgery, and you don't have to go through that. You don't have to live, being infertile. You don't have to live your life thinking that the fibroids could grow back, with the myomectomy procedure. This is something that's one and done. You get it done, you're up and at it in 4 days, 5 days, and you're just going on with your life like a normal, regular person. And it won't put hair on your face.